Today we're going to be discussing xylazine, a new deadly threat to public health. The White House released another press release. This would be 3 of 4 press releases, and has issued a national response plan. And so the timeliness of this presentation is one to catch you up to speed on xylazine and its combination with illicitly manufactured fentanyl, as well as just a broad overview of xylazine. The objectives for today are to recognize the clinical presentation and risks associated with xylazine exposure, identify barriers to identification and appropriate treatment for that exposure, assess the emerging threat of xylazine combined with fentanyl, and then to give you a list of overdose mitigation strategies for xylazine. So essentially, we're going to delve into what is xylazine, how it's showing up in our illicit drug supply, as I said earlier, with the emphasis on the combination with fentanyl. And then we just want to help our healthcare professionals who work in this arena and are taking care of individuals who are high risk for xylazine exposure, just in detection, management, and patient education. A bit of background on xylazine. It was first synthesized by Bayer Pharmaceutical in 1962 as an antihypertensive agent. Clinical trials were shortly terminated due to unacceptable levels of sedation and hypotension. They deemed the drug unsafe for humans and, again, terminated all those trials. Therefore, it's not approved for use in humans. Its only use is in a veterinarian space and is also noted to not be a controlled substance currently under the Federal Controlled Substance. I have here listed for you the press release that was issued on July the 11th, 2023, regarding the emerging threat of fentanyl and xylazine. This was just the first designation in U.S. history, and also with this designation, the first national response of this kind. The one reason that this was issued is that the CDC in June reported data that showed an increase of 276% of fentanyl plus xylazine involved deaths. Now, this data was from January 2019 to June 2022. They also noted that the detection of xylazine has now been found in all states. I also wanted to point out this quote. This was with a statement that was made in March of 2023 that stated xylazine is making the deadliest drug threat our country's ever faced, fentanyl even deadlier. The other thing I want to briefly highlight here is that xylazine fits underneath an umbrella of what we call novel psychoactive substances, and so there's just a lot of unknowns in this space. One of those just being co-ingestion, how individuals access those, the fact that these novel psychoactive substances are very diverse, they're modified, synthetic oftentimes. They will sometimes mimic prescription or illicit meds that may be more potent than what is currently available. The end user sometimes uses them unintentionally or intentionally, but they're truly meant to avoid regulation, which causes testing challenges. And so as I go through the presentation, just kind of keeping that in mind, that xylazine has a lot of unknowns, and I'm hoping by the end of the presentation we can clarify some of those for you. High-level information on xylazine. First, it is a non-opioid veterinarian tranquilizer that's not approved for human use. In the veterinarian space, it is a sedative it has analgesic effects, and has potent muscle relaxant properties. Some of the names that you will hear primarily on the street is Trank and Trank Dope. There have been some mention in the media realm as the zombie drug. So hearing any of those names, know that they are referring to xylazine. Routes of administration can include parenteral, primarily IV, IM, nasal, oral, and inhalation. There's been, like we stated earlier, an increased prevalence as an adulterant and illicit substance. While we focused on fentanyl, we also would want to include heroin and cocaine in those co-ingestions, and I will mention some others later on in the presentation. It's currently unknown whether xylazine is illicitly produced or diverted from the animal drug supply. There are several brand names in the veterinarian space. All of them are solutions. So they come in like a clear liquid. There's 20, 100, and 300 milligrams per ml vials. But once the xylazine is adulterated and becomes an illicit use, it's likely going to be a solid or a powder. That's what we're seeing primarily in the Northeast. And then we are starting to see pills and tablets formulated out of xylazine, and those tend to be more on the West Coast. Xylazine is structurally similar to phenothiazines, clonidine, and tricyclic antidepressants. The reason why it's similar to tricyclic antidepressants is it has that very similar three-ring structure to its chemical makeup. The pharmacology of xylazine is well established in animal studies. However, human studies are limited, and there are currently no pharmacokinetic studies in humans, so the effects in humans are largely unknown. We do know that it is a potent alpha-2 adrenergic agonist, and it also can have pretty significant reduction of dopamine and norepinephrine release in the central nervous system. Onset of action can be minutes with a half-life that can range anywhere from 25 to 60 minutes with a length of action of 4 hours. What I will say here is, again, these are animal studies and not human studies, and we have seen that these numbers can be variable depending on a couple of things. First, is the user of the xylazine using it IV? Because this information here that we have listed is IV use in animal studies only. But say, for example, you have an individual who's attempting to give it IV and misses IV and it goes into the IM phase, then the effects can be variable and usually longer. So we have effect data that is anywhere from hours, days, and sometimes even longer. It's known to increase the euphoric effects when added to fentanyl, and it's sought after as an adulterant to lengthen the short duration of fentanyl effects. There is some recent data to show that there are other reasons why we may be seeing xylazine added specifically to fentanyl. A couple of things is very easy to access. It's cheap, so it can be used as a bulking agent, and oftentimes the end user desires it because they may have polysubstance abuse with a stimulant such as methamphetamine and cocaine, and so the xylazine can offset some of those stimulating effects. The risk profile of xylazine, the most important thing to note here is that because it is not an opioid, it cannot be reversed by naloxone. The other thing is that the end user is oftentimes unaware of the exposure, so they have an unexpected or atypical response to a fentanyl or heroin exposure that they would be used to. The other is repeated exposure may lead to severe necrotic skin ulcerations that require anything from complicated wound care and antibiotics to worst case scenario of leading to amputation. We know that repeated exposure to xylazine can lead to dependence and severe withdrawal symptoms, and those withdrawal symptoms are sometimes severe and are not able to be managed with standard treatment options. The veterinarian reversal agents have not been shown to be safe or effective in humans, so there are currently 2 agents that a veterinarian would use in an animal population to reverse effects. But again, just emphasizing here that those have not been safe and or effective in humans. Healthcare professionals managing patients that could have potentially been exposed are encouraged to increase testing, education, and assess for these wounds and warn these users of the naloxone, which the brand name for naloxone is Narcan, non-response. We also have looked into some recent literature about why is this so much more lethal when combined with fentanyl. And we think that xylazine exacerbates opioids worsening of brain hypoxia, so you're getting less oxygen to the brain. And so essentially, xylazine is causing more brain hypoxia, but it is also dramatically reducing the compensatory mechanisms used to counteract that hypoxia. And then now you have a situation where the reversal agent for the opioids, which can also cause the brain hypoxia, isn't going to work to reverse xylazine. Presentation and detection. Patient presentation is going to be variable, but some of the things that you may see are narrowed pupils, bradycardia, hypotension, a decreased level of consciousness, and then these severe necrotic skin ulcerations and abscess. You're unable to detect in routine drug screens, and so you have to use targeted definitive testing methods such as gas chromatography, mass spectrometry, or liquid chromatography, tandem mass spectrometry, to identify these substances. The turnaround time can be anywhere from 3 to 7 days, with an average of about a 3-day period of detection. As I was saying earlier, those again can be quite variable. I do want to mention that Aegis has been testing for xylazine for over 2 years, and again, variable periods of detection based on the specific urine or oral fluid samples that we may receive. And some of that, like I said, has to do with the route of administration, the amount of xylazine that was ingested, and could be even as simple as the hydration status of the individual whose urine specimen that we're testing. It's important for the end user to know what's in their product, especially with IV, as we know that xylazine is playing a higher risk of suffering a fatal drug poisoning. Several months ago, there was a company in Canada who got approval and released xylazine testing strips. So I want to make you aware of this. They are rapid response xylazine test strips, only meant to test liquid and powder forms of xylazine. The strips are about $3 a piece, high sensitivity, and they're only for harm reduction purposes for the user only. So this isn't something that you're going to see in your clinic, but it may be something that you may encourage an individual who is using illicitly manufactured fentanyl or using really any type of illicit substance to have these available. They're not intended to determine purity, composition, or if a substance is safe. We do know that a positive result does indicate the presence of xylazine, but it will not tell them the amount of xylazine in the product, and that the negative result doesn't rule out the presence of xylazine. So the level may have fallen below the minimum detection of that test, and therefore it could be a false negative. This specific test does detect xylazine at a concentration of 1,000 nanograms per milliliter, and the end user who is testing these samples should know that the results would be available in 60 seconds and not to read any of these tests after 10 minutes due to the fact that they can become even more inaccurate at that time. The prevalence of xylazine, as we are aware, has continued to grow. So the purpose of this slide is just to show you a visual for the last 7+ years and the increase in the detection of xylazine. There are a couple of things that I want to point out here. First off, xylazine was found in the illicit drug space first in the early 2000s in Puerto Rico, and it was identified in Pennsylvania, and Pennsylvania's kind of been named the epicenter of the xylazine crisis, and it was first detected in 2006. So starting in 2015, you start to see detection of this, and then by 2021, you see how dramatically this curve increased. The one thing, again, on this slide I want to point out is that the illicit manufactured fentanyl was present in, at this time, close to 99% of xylazine present overdose deaths. Most of this was occurring, and the increases were occurring in the Northeast, and now, as I've stated earlier, it has spread out and is now involved in detection overdose deaths in all 50 states. Looking at substances found with xylazine, this is actually an Aegis data, and it was published in April of this year in the Journal of Addiction Medicine. And the takeaways from here is to look that we at this point were identifying 413 of close to 60,000 samples. Of those, they originated from 25 and 39 states where testing was ordered. We just received recent data that in Q1 of 2023, that our detection has gone above 2,000, and 3 months later in Q2 of 2023, that detection almost doubled. The other thing to point out in the numbers and the drugs listed on the far right-hand side is an emphasis on polysubstance abuse. So when we detected xylazine, we were also detecting other substances. And most likely these substances were not combined into one product, but more, again, an emphasis on polysubstance abuse. And the thought and the space that we're sitting in is, are we detecting more xylazine because we're testing more, or are we seeing an increased prevalence in the drug supply, or is it a combination of both? And it is likely the latter. So we are testing and detecting it more, but also it is very likely that the prevalence in the drug supply has drastically increased in the last 3 to 5 years. Here is a list of all of the novel psychoactive substances I mentioned at the beginning of the presentation. Just wanted you to be aware, currently this is what Aegis has available for testing. So thinking about an individual who may be using xylazine and could be potentially using fentanyl. If you're testing just for fentanyl, you may miss a potential designer opioid that your testing may not detect. And so therefore, we would encourage you, depending on patient presentation and the individual characteristics of the individual, to be mindful that you may consider expansion of testing in a high-risk patient, especially those with polysubstance abuse that could be getting access, again, knowingly or unknowingly, to a novel psychoactive substances. The one thing I want to mention is that we evaluate this list. You look at drug seizures, FDA, DEA data, and we evaluate this and modify and revise and expand this list as the market changes. And we will release, hopefully by the end of the calendar year, an updated list, even including a drug where we're starting to see appearing in the drug supply that is very similar to xylazine, medetomidine, and so that's just an example of where we're seeing it show up, and we know that it's important for our healthcare professionals and our end users to know if they've been exposed. And so again, just letting you know that our NPS testing is quite comprehensive, and we try to keep the moving target and the kind of ever-growing, changing market is up to date and test for these things to help our clients and patients. Here is an example of one of our samples where the clinician actually ordered a lot of our novel psychoactive substance profiles. So if you look at the green, you'll see here that this individual was just prescribed buprenorphine naloxone. That would represent likely a prescribed Subutex or Suboxone or Zubsolv type product. And then everything in white were things that we found that have prescriptions available for them. So you see here alprazolam, fentanyl, gabapentin, lorazepam, and tramadol. And then everything in yellow is an illicit substance. So when the clinician ordered the testing, they found cocaine, marijuana, designer benzos. There's that xylazine. Please note that it was in combination with fentanyl, but it was also in combination with a designer opioid. In this case, it was fluorafentanyl. So you have a situation of a very high-risk individual for a potential fatal drug combination. And had they not checked for us to test this, how much they would have missed in the ability to just handle harm reduction and risk mitigation for this individual. But just wanted to show you an example of kind of the comprehensive nature of the testing Aegis is capable of completing. Now moving on to the xylazine-induced skin ulceration. The mechanism is thought to be due to the direct vasoconstricting effect of local blood vessels and the resulting decreased skin perfusion. Prolonged use with xylazine can lead to decreased perfusion and impaired wound healing, leading to higher chances of infection of these ulcers and the topical effects of the vasoconstriction. There are excipients found in the xylazine preparations. If you remember, I told you the solutions are most commonly changed to solid and powder forms, and that process may be adding things into the products that can be contributing to the skin ulcerations as well. There's a high prevalence of skin ulcerations that develop over various body parts, irrespective of IV injection sites. So, an example, maybe an individual is injecting in a clavicle space or in their hands, but then the ulcers show up in their lower extremities. So knowing that where they are injecting is not always where the skin ulcerations are developing. The other concern is once an individual realizes that they do have xylazine in their product, they know that xylazine has analgesic properties and can cause pain relief. And so these very painful skin ulcerations, they start injecting directly into the ulcers, which could enhance the properties of the kind of devastating like skin and soft tissue infections that could be present. The case presentation related to an individual who had the skin ulcerations. This is a case of someone who was chronically and knowingly using xylazine containing fentanyl. The 37-year-old female with known opioid use disorder. She was a resident of Philadelphia, Pennsylvania, and a methadone maintenance program. She presented to her addiction medicine clinic for a routine follow-up and admitted to 10 bags of IV fentanyl and heroin, which she referred to as dope, daily, and 5 alprazolam bars. That would equal about 10 milligrams of alprazolam, prescription drug name for alprazolam being Xanax. During the visit, she complained of bilateral skin ulcers to her lower legs that had started spontaneously a few weeks prior to the visit. During the visit, her vital signs were stable. She reported that she was injecting into her hands, but occasionally her legs. She did have a history that was positive for some severe skin and infection type related illnesses, including osteomyelitis, septic arthritis, and bacteremia. And most of her treatments, which she would go into the hospital, were incomplete because she would leave against a medical advice. I have a disclaimer here in case you do not want to see the severity of the skin ulcerations. They are quite graphic, so I will give you a heads up when I click off the next slide. She was transferred to the local emergency department where she was diagnosed with cellulitis, osteomyelitis, soft tissue abscess, and had to be started on broad spectrum, quite potent antibiotics, which was a combination of vancomycin and piperacillin tazobactam. As you can see in these photos, they were attempting to do bedside wound care. This is an image where the infection has gone all the way to the bone. You can see kind of all layers of her skin and the necrosis of a lot of the tissue. They did provide wound care and pain management, and then also did continue her methadone for the opioid use disorder. And I have clicked off that slide so you can look again. The patient presented 5 additional times to the emergency department in the following 2 months with a very similar presentation, with her final discharge being to a recovery house. She was continued on methadone, was able to be converted to oral antibiotics from her IV antibiotics, and then had topical wound care. In general, monitoring recommendations for individuals you think may have been exposed to or are knowingly exposed to xylazine need to be blood pressure, blood glucose, heart rate, EKG, normal kind of monitoring of electrolytes and pH, as well as skin assessments. A lot of individuals who come into clinics are going to be covered, so asking them to show maybe their arms or legs, or even just being mindful to ask about any skin ulcerations, because we do know that while there are deaths related to xylazine for other reasons, that we are seeing an increase in the morbidity and mortality of wound-related effects of xylazine as well. After a period of abstinence off of xylazine, continuing to monitor for neurological changes and implementing measures for withdrawal as you would with an individual with any other type of substance use disorder. Below is a treatment outline. It was in a case report which showed a multimodal approach to an individual who was in a withdrawal type circumstance, again, known chronic user of xylazine. And you can see this is a situation where they tried a lot of different medications to address the presentation of the withdrawal, as well as the treatment of the skin ulcerations for this individual. First, they started out with a combination of phenobarbital, dexmedetomidine, and tenazidine. Those were continued per kind of hospital protocol. I've provided dosing here for you if you were interested. Over the course of several days, they converted this individual to a combination of clonidine, buprenorphine, and gabapentin. I will note here that the buprenorphine that they were using, they had converted to microdosing and were using at very low doses so that they could continue hydromorphone to help control the pain that the individual was experiencing from the skin ulcerations. There were also, as needed, ketamine infusions during the dressing changes for the skin ulcerations as well. On day 19 of this hospital stay, the individual was discharged on a combination of clonidine, buprenorphine, and gabapentin. The next scenario is a situation of an overdose, and this was more a systematic review of case reports. So this isn't one study. It was a combination of case reports and small cohort studies. So everything at the point at which we created the presentation that have been or are currently being tried in this space. So you see a variety of different approaches here. The things that I want to highlight are that you need to be mindful that, one, they're still giving Narcan or the naloxone because of the co-ingestion with a fentanyl or an opioid. And so the naloxone can help reverse the effects of that portion of the ingestion. But what I will note is that normal dosing of naloxone was not effective. They were having to go anywhere from 4 up to 10 and 12 milligrams of naloxone, and even in some circumstances, we're having to put people on naloxone drip. Other things to be very mindful of are rescue breaths, airway support, and mechanical ventilation. Emergency departments, first off, are not able to currently test for this product. And so if you needed to know is someone is under the exposure of xylazine, you go back to the testing, and that can take, again, 3+ days. That's not going to be feasible for acute treatment of an overdose in an emergency department. So what the new kind of research is stating is if you have an individual who has decreased respiratory rate, has a positive on their drug screen for an opioid, or admits to use of fentanyl, to kind of assume xylazine if you have a atypical or non-response to naloxone, or you have an individual who has skin ulcerations. The other thing that is recommended is in an emergency department setting not to give naloxone and then shortly release a patient, because we are seeing individuals who leave the emergency room, then return back and are back in respiratory depression again with no reuse, and knowing that that is likely the xylazine prolonging that respiratory depression and respiratory effects. So one, treating individuals longer, and also being mindful higher doses of naloxone for the co-ingestion of opioids, specifically fentanyl, and then to know that you're going to likely have to have a more aggressive approach to airway support. So in summary, we know that publications are indicating a trend of increasing detection in these drug samples, tox cases, and overdoses. The fact that people who are using these substances may be unknowingly consuming xylazine, and that healthcare professionals should continue to administer naloxone for opioid overdoses, and then consider xylazine exposure in patients that are either not responding or having an atypical response or have signs and symptoms of the xylazine exposure, namely those severe necrotic skin ulcerations. Healthcare professionals should provide appropriate supportive measures to patients who do not respond to naloxone, and then a strong consideration for appropriate testing when clinically appropriate in a high-risk patient population, which we currently know based off that new White House press release and the information from the CDC IV fentanyl use. Here is our clinical team, and I have included our telephone number and our email. This is a dedicated line. If you have questions related to xylazine or any information, we would be happy to help you.